Good day, and welcome to another edition of COVID Conversations, where each week we talk with the experts about the ever changing and ever growing details about the coronavirus. I'm Bremante Bryant in for Harold Fisher. This week, our focus is COVID and kids. Now, if you ever want to see or hear a heated debate about the coronavirus, just watch any of the many school board meetings in recent months around the country. Those hearings and meetings, without a doubt, are passionate, loud. Some have even turned violent. But today we are not debating the mask mandates or the relaxing of mask guidelines in schools. Our focus is on COVID conversations. Our focus on COVID conversations, rather, is on the science. That's why we bring you the experts each week to help you make the very best decisions for you and your family. My guest today is Dr. Marilyn McPherson-Corder, a pediatric medicine specialist in the Washington, D.C. area. Dr. Corder has over 4 decades of experience in the medical field and is a well sought after expert. Dr. Corder, thank you so much for being with us as usual.
Thank you so much. I appreciate it.
Let's begin. According to the latest stats from the American Academy of Pediatrics, there have been nearly 13 million child COVID cases, representing about 19% of all COVID cases. 29,000 of those cases were reported in the past week. So I want to get your thoughts on those numbers. Are we still in a pandemic when it comes to children in COVID?
Absolutely. And thank you again. As a pediatrician, my fear has been now that many of the jurisdictions, the educational sites, are reducing the mask mandate. Now, we do still know that children 5 and below can't, there are no vaccinations. Now, those are those children that the population that really likes to hug and kiss and share toys and share bottles and everything else. Unfortunately, they're sharing everything, including germs, as we know, as well as COVID. And COVID is still here. We're now at the BA2 variant. We haven't gone through the letters and the variants. And I know when I was on a few talks, I warned about after Christmas holiday. And we saw that surge to the point 20% of COVID positive individuals in the United States were children. And a good 10 or 15% were children who could not even get vaccinated. So we are talking about the population most at risk. Those children often have different symptoms of other things such as flu and others that you don't know what's going on. They're constantly bombarded with their friends and relatives. So it's like a vicious circle and a cycle, and often we don't know. So going back to your question, where are we now? We're still in a pandemic. We're still in a pandemic. We still have to mask up, and we still need to hand wash, and we still need to make sure that we're tested. So there was a time we didn't have enough tests. Then there was a time we finally caught up here in the Washington D.C. area. But now it's almost like, well, okay, I guess I'll get them tested, or she tested, and we still need to test. We had 7 new cases in my practice over the past 2 days alone. So it's not gone. It's still here.
What should parents be doing as we get to this place of learning to live with COVID? Because that's real. We have to learn to live with it. I'm assuming you believe that's true. So, what should parents uh, be doing as we are getting to this learning space?
Yeah. It's kind of like a new normal now. And I like that, learning to live with it. You want to learn to live with it, but you also want to learn to respect it, right? And respect it to the point even beyond how we respect flu, because we do see we do see illness severity, speaking for the 979,000 deaths from COVID alone. So, on behalf of that population, and now knowing 20% have been children with the infection, we need to learn to live with it with our guard up, hand washing, understanding what those playmates, families are, doing. If they just recently come back from Japan, did they recently come back from an area that we've seen a surge? What about symptoms? Sore throat may not just be strep. So you want to be having that still in the top 5, maybe in the top three, depending upon where you are. Because often we talk about cold and allergies. We're in an allergy season, and it's going to be rough. By the way, this is not an allergy talk, but it's going to be rough this time. But as
Why
well,
why
those
so?
same,
You think it's going to be rougher? Why
yes,
so? And it's important for people to know that because as you're thinking it may be COVID symptoms, it may be allergies, and why will it be rougher this
right.
year, Dr. Corder?
Well, be it climate change, be it we all been inside, be it our tolerance, all of the above, especially here in the DMV. So we already seeing asthma attacks, allergic reactions, swelling, etc. And we in cherry blossom time. So it's already predicted. One day we have a cold winter day, and in 2 days we'll have 70 degrees. So I think between the ups and downs, the rapid changes in the temperature is really rough. Now, with that being said, we still have upper respiratory symptoms with COVID. And just today, I told four families, please get he or she tested. Sometimes the schools would do it, but the rapid test or the PCR is going on the back burner too soon with us taking off the mask. And I feel that we're a little bit too laxed right now. And I think that if we don't really keep vigilant about the pandemic, we're going to see like we saw in January.
Are respiratory symptoms for kids more pronounced? Are there any signs of that? Is it trouble breathing? Is it wheezing? Is it,
Right.
what should we look for?
Well, it's interesting because, of course, we know the respiratory tract of a child is much smaller than ours. So when we have sniffles as a grown up, it's a little sniffle. That same sniffle can lead to an upper respiratory infection, can lead to a bronchitis, can lead to an asthma attack, depending if that person has asthma. So I always tell folks, find out what's going on in terms of even the what's going on outside the zones, as well as making sure, often I'll say get a pulse ox to understand what the oxygenation, because one thing about COVID, if it's in your lungs and attacking your lungs, you have a more severe reaction in terms of the cilia, the lung linings, and the cells really go through um, a major attack if COVID is in your lungs. So it would be like an asthma attack, but it's worse. And that's where we have those children in the ICU on vents, on respiratory support because of what COVID will do.
Now, the reality is we still have many kids who are not vaccinated who are eligible to take the shot. So, for those parents who are not taking their kids in to get these shots, what would Dr. Corder say to those parents?
Well, first I'm going to say I understand, and I'm going to say this with love. You know, we don't like to get vaccinated. We have our history of that, as
And
well as now with
when you say we, are you speaking specifically the African American
yes,
community?
people of color.
Hmm.
Exactly. And then when you get the history, when you get the reports of, well, that vaccination lasted only 6 months, and then you have to get another booster and another booster, then that raises um, mistrust or it not be necessary. And I've had my patients tell me, well, as long as a lot of people, most people get it, that's fine because I'll benefit from the herd effect where everybody else getting it. But those numbers, those deaths, you don't want it to be one of your loved ones in that number. So what I do say is I understand the American Academy of Pediatrics is approving it. We're now going to go down to less than five. We're testing, we're monitoring, etc. Those children who are certainly immunocompromised, my sickle cell patients, my asthmatics, my diabetics. If they get sick, they're already at a compromised, state. It's not a good thing to watch.
You mentioned that we're getting to maybe that process for vaccination for under five, but we're still not there yet for
Right.
children under five, correct? So, how do
Correct.
parents and caregivers protect that young population?
Exactly. And they often can't tell you how they feel. And we talk about what's their energy level like. Let's just say, as I have seen over and over, a child who's positive, who's 4 years old and COVID positive, and he or she may have gotten it from a classmate or a playmate or a relative even. My thing with my warning or my suggestion with parents is this COVID variant, be it the Omicron, the BA1, the BA2, what have you, is very transmissible. And often now with children, we see it's very aggressive if it's going to be aggressive. And I know that sounds like I'm just, mixing words. When I say it's going to be, if there's some asymptomatic mean you have it, you're positive for it, but you're really not showing signs, maybe a little sniffle. But there are some children who get sick and within a day or two need to be in a hospital in an urgent care being monitored. Don't sit on it. Don't just say, well, it's just sleepy, energy levels low. I'd rather you get him tested or she tested and know what it is versus wait and it's not your common virus.
Make clear for us, Dr. Corder, we hear about this new variant that is on the way, that is overseas, but it's coming here to the U.S. mainland at some point. What should we know about that? How should we try to guard ourselves against it? Should we be concerned about it for our children?
It's actually here now, Demonte. And of course, you know what's happening. We're flying everywhere. Travel is lifted. People are ready to go, vacations and just needing to get away. So it's pretty much here. So I'm telling folks, and I know in my area, people are international. People are traveling. We have three main airports, and folks are going everywhere from Starbucks to wherever. So I'm preparing them and saying it's here already. And just like we saw the surge with the variant, we need to make sure that we still stay vigilant. Still put your mask on. You whatever age your child, 11 years old, 16 years old, uh, 4 years old, try to still keep your mask on and get tested. I'm still saying get tested. I know we wear out the urgent care and the places, the testing sites, but please get tested. The lack of knowledge can do you more harm than the inconvenience of getting tested.
Dr. Corder, what are your thoughts on this pushback from many parents? And we see it in a good many counties, especially in Virginia. I'm just talking about here in our area.
Yes.
Uh, and we're not necessarily talking about lifting mask mandates, in this conversation, but it is relevant, obviously, right, to small children in classrooms, those who cannot be vaccinated, who are in pre-K. What are your thoughts on how that is affecting the issue around young kids and vaccinations, and even those, as we've mentioned, under 5 who can't have them, but mask mandates are lifted?
Well, I have to take a deep breath before I answer that because it's scary. When I heard this, is a lot of politics around this, and my child has a right not to wear a mask, and I'm like, well, also you are supposed to protect your child, and your child has a right to be healthy, and the next child, and the next child. So my comment and my concern is that as they lift the mask, lift the mandates, closer groups, more frequent people, people 4 and 5 together versus, it used to be like one family to another family. Now it's a group, it's a playground group. The sports are opening up. So it's frightening. And my thoughts are we're doing it too soon. We're unmasking too soon. Um, you know, we feel that we have gotten it much, we, we have a handle on it, but I think all the efforts that we have done, um, people in medicine that we've done and working hard on the front line and trying to educate, I feel that all that effort will, just will be in vain if we just say, okay, everybody lift up the mask, let's go to the bars, let's go to the clubs, let's go to the playground, let's go to all of that, and then you have one or two cases, and this is very aggressively transmittable, and just one person, one death is one too many.
Speaking of educating, is it ever too early to educate young children about COVID? And how should we do that?
So I educate in my office, and I will say this: 2 and 3 year olds, 2 and 3 year olds, they wear their mask. They tell their parents to wear the mask. It's like they're better than some of these grown-ups. And it's like everybody's doing it. Put your mask on. They have cute little masks, etc. And the education is this is a germ. I'm not trying to frighten them, but this is a germ that we don't want you to have. because you may have to go in the hospital, you may have to see the doctor, you have to have needles, IV, etc. So what we're going to do is protect you against this bad germ. I've had little ones coming in with their doll babies with masks, and that's because they get used to it. They're comfortable, and I feel that they adjust to wearing masks better than some of the grown-ups.
Are we seeing anything different, anything particular with kids in the Washington metropolitan area, or what's happening in our area pretty much is what we're seeing all over the country? Is there anything particular to our area?
I feel that we are doing well. When I talk to my colleagues, I'm part of the National Medical Association. We talk to my colleagues in different areas like Mississippi, well, a few states I won't mention all of them. They tend not to respect it as much in terms of the Omicron, in terms of COVID and all of the variants than we do. I feel that our health officials, both in DC and in Maryland, they get it, as well as the health officials in Virginia. It's just that sometimes the science, the, the the science is not respected, unfortunately. And I understand it's an inconvenience, but it's an inconvenience to save lives. And that's so important. We have to make sure that we know why we're doing it. We're not trying to inconvenience you because we just want to do that. It's for a purpose. It's for life-saving measures and purpose. And to do that well, we need everybody to come to the table and everybody to do this. Now, we're not bad. When I look around and I hear the stats, but we still have folks in the hospital. We still have children's hospitals, still have children in the ICU with COVID.
With the news coming down that a second booster has been approved for adults, where does the booster shot, does that at some point, will that be applied to children, or is that not something we should even be expecting?
Well, I don't have a crystal ball, but I will say this: from what I'm seeing, as it trickles down from the seniors to the middle aged, all the way down to the teenagers, it's coming. Now, of course, I always say this: children are not small adults. We have to make sure that we respect their young bodies, their heart, their lungs, etc. We have to make sure we do enough studies before we roll out the vaccine. And that's why, it's so very important to keep them safe with masks, with the precautions that we have in place, because we know they can't get vaccinated, and we want to respect their lives. So boosters are coming. They already here for the teenagers, as we saw, 6 months ago. So in my experience, they will be coming, not only just the vaccine, but they will be coming like we have boosters for other things.
Dr. Corder, as we close out, any final thoughts as we enter the warmer weather? And there's an eagerness, as you've even mentioned earlier, a return to a sense of normalcy that will kick in, especially as it gets warmer and we want to go outside. What's your best advice for parents and those who are caring for children?
Right. I want you to understand that as we do come into the spring, and well, the lack of mandate for the mask, that you still understand that we do still have COVID among us, whatever variant it is. And my advice is to keep a thermometer, look at your children, stay vigilant, get tested, call your doctors. If there's a question of whether or not your young person may have been exposed or even have coronavirus, COVID-19, and all of the variants.
Dr. Marilyn McPherson-Corder, your expertise is always welcome. Thank you so much for being with us.
Thank you, Demonte. Have a good evening.
You too. And thank you all so much for joining us this week for COVID Conversations, where each week at 12 noon, we bring you the experts to help get us beyond the double talk and straight to the facts. Make sure you join us next week as we talk with a White House COVID advisor. I'm Bremante Bryant, sitting in for Harold Fisher. Have a safe and healthy week.